Hello friends, myself Namrat Kaur. Today is my first YouTube video. I hope you guys will like it, enjoy it. Please subscribe my YouTube channel, like, share, comments. I'm always there for you. So our today's first topic is the aims of exercise therapy, the approach to the patient, the assessment of the patient. Let's start with it. What are the aims of exercise therapy? Okay, basically tell me, why do you need to perform an exercise? So what are the aims of performing an exercise therapy? That is what we are going to study. There are three aims of exercise therapy. The first aim tells to promote activity and minimize inactivity. It means whenever and wherever it is possible, I'll tell my patient to do an activity. Even if he is in pain, if it's a bearable pain, I tell him to do an activity and I promote him to perform an activity, and I will try to minimize the effects of inactivity. So our first aim is to promote activity and to minimize the inactivity. What is our second aim? Our second aim tells us about to correct the inefficiency of muscles and to regain range of motion. What do you mean by correct the efficiency of muscle? Okay, if I am performing elbow flexion and I do not have a proper range to perform an elbow flexions, my muscles are not working properly to perform an elbow flexion. So that it means that to correct the inefficiency of the muscle. And why we need to do that? We need to do that just because to regain our range of motion. That is our second aim. Moving to our third aim. Our third aim is to encourage patient to use what he or she has regained. Okay, for example, I am performing exercise on my patient from 10 days and I'm performing on repetition. Now, patient has gained some range, so I will encourage my patient to use whatever he or she has regained. That is our third aim. What are the techniques? Techniques में आ जाएगा. We'll perform active exercise, we'll perform passive exercise. Active exercise, like patient is able to perform it by himself, herself, and passive is that the therapist is performing on the patient. There is no active role of patient in performing the exercise. Moving to the assessment of the patient. What is assessment? The first point is what we'll take. We'll take the demographic data. What is demographic data? Demographic data is the name of the patient, the age of the patient, the problem of the patient, the address of the patient, the mobile number of the patient. So this is all about it's like the basic information about the patient. That is our the demographic data. Now we need to ask questions to our patient to assess the patient. There are three basic questions we ask to the patient. The first question is, what does patient needs to do? Okay, हम पूरा दिन नहीं होते पेशेंट के साथ, सो द प्रॉब्लम लाइज इन वी कांट असेस कि क्या पेशेंट की क्या नीड्स है, क्या एडीएल्स है. एडीएल्स इज एक्टिविटीज ऑफ डेली लिविंग. तो क्या एडीएल्स है, पेशेंट की क्या नेसेसरी है. तो इसकी वजह से हम क्या करते हैं, हमें कोऑपरेशन चाहिए किसका, पेशेंट का और पेशेंट के जो नेबर्स हैं, जो मेंबर्स हैं, फैमिली मेंबर्स, राइट. तो वो हमें आके बताएंगे कि पेशेंट की ये नीड है, पेशेंट अपनी ड्रेसिंग नहीं कर पा रहा, पेशेंट अपने हेयर्स कोम नहीं कर पा रहा, सो दैट इज द प्रॉब्लम. सो दैट इज व्हाट पेशेंट नीड्स टू डू. हम पहले ये जानेंगे. सेकेंड पॉइंट ये है, व्हाट कैन पेशेंट डू. अब इफ पेशेंट इज कंप्लेनिंग मी आई कैन ड्रेस प्रॉपर्ली, he can dress but he can't dress properly, so that is where somewhere his range of motion is affected. So I focus on that. The third point is, what is patient unable to do. It means it was like, what can patient do. Patient was able to do certain things, but patient was unable to do other than the range of that certain things. So that is, we'll assess in the third question that what is patient unable to do. This is all about the assessment of the patient and the aims of exercise therapy. See you in next video, guys. Bye bye.